Welcome back to our channel where we provide informative comparisons of healthcare devices. Today we'll be exploring the differences between two widely used cardiac monitoring devices, the Holter Monitor and the ECG electrocardiogram. Both devices serve important roles in diagnosing and monitoring heart conditions. Join us as we delve into their features, functionality, and applications. Let's get started. The Holter Monitor is a portable device used to continuously record the electrical activity of the heart over an extended period. It consists of electrodes that are attached to the chest, connected to a recording device worn by the patient. The Holter Monitor is technically worn for 24 to 48 hours, allowing for a comprehensive assessment of the heart's performance during daily activities.
Still wasting money on ads that get ignored? Let influencers tell your story. Promotional Pack connects your e-com brand to the right niche influencer to reach your target audience. Get more sales with less spent. Link in description.
On the other hand, the ECG, also known as the electrocardiogram, is a diagnostic test that captures a snapshot of the heart's electrical activity at a specific moment. It is usually performed in a medical facility by placing electrodes on the chest, limbs, and sometimes the legs. The ECG provides a quick assessment of the heart's electrical signals, allowing healthcare professionals to identify any irregularities or abnormalities. Duration of monitoring. One key difference between the Holter Monitor and ECG is the duration of monitoring. As mentioned earlier, the Holter Monitor is worn by the patient for an extended period, usually 24 to 48 hours. This allows for the continuous recording of the heart's electrical activity during various daily activities and sleep. In contrast, an ECG is a brief snapshot taken at a specific moment. The test typically lasts a few minutes, during which the electrodes capture the heart's electrical signals. This provides a snapshot of the heart's activity at that particular moment, but does not provide continuous monitoring over an extended period. Mobility and convenience. When it comes to mobility and convenience, the Holter Monitor offers more freedom of movement. Since it is a portable device, patients can go about their daily activities while wearing it. This allows for a more comprehensive assessment of the heart's performance during routine tasks, exercise, and sleep. The ECG, being a test conducted in a medical facility, requires the patient to be stationary during the procedure. While it is a quick and efficient test, it does not provide the same level of mobility as the Holter Monitor. Diagnostic capabilities. In terms of diagnostic capabilities, both the Holter Monitor and ECG are valuable tools for identifying heart conditions. However, they serve different purposes. The Holter Monitor is particularly useful in detecting and monitoring irregular heart rhythms or arrhythmias that may occur sporadically. By capturing the heart's electrical activity over an extended period, it provides a more comprehensive picture of the heart's performance. The ECG, on the other hand, is effective in diagnosing acute heart conditions and identifying specific abnormalities or irregularities in the heart's electrical signals. It is often used as a preliminary test to assess the heart's overall health and identify potential issues that may require further investigation. Healthcare professional involvement. Another important consideration is the involvement of healthcare professionals in the interpretation of the data obtained from these devices. For the Holter Monitor, the recorded data is typically analyzed and interpreted by a healthcare professional. They examine the data for any irregularities, arrhythmias, or abnormal patterns that may require further investigation or treatment. In the case of an ECG, the test is usually performed by a healthcare professional, such as nurse or technician, who is trained to place the electrodes accurately and record the heart's electrical signals. The results are then reviewed and interpreted by a healthcare provider, such as a cardiologist or physician. Both the Holter Monitor and ECG are valuable tools in cardiac monitoring and diagnostics. The Holter Monitor provides continuous monitoring over an extended period, offering a comprehensive assessment of the heart's activity during daily activities and sleep. On the other hand, the ECG provides a quick snapshot of the heart's electrical signals, aiding in the diagnosis of acute conditions and specific abnormalities. We hope this comparison has provided you with a better understanding of the differences between the Holter Monitor and the ECG. Thank you for watching, and don't forget to subscribe to our channel for more informative content.